Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita, you look gorgeous.
Thank you.
Life treating you well?
Yeah, everything's fabulous. I'm sipping my tea and talking to you, and it's all good.
You living it up?
Absolutely. You too?
All right. Yeah, then we're ready to teach people how to heal their musculoskeletal orthopedic pain without surgery, hopefully.
I love it.
The way we do that, for all you folks listening, is hopefully you will call us up and you'll get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We've got a couple hundred pages of information on all different body parts and how stem cells and platelets, called PRP, can help heal you. Just walk in, get injected, and walk out. You can drive yourself home. Very, very, very few side effects, a little bit of stiffness afterwards, and that's about it. None of the things that happen during surgery, and although I was going to be a surgeon until I had my shoulder operated on in med school, and I did love doing it. It was a lot of fun. I'm not a proponent of it for most of these surgeries. I'm sorry to say that. I argue with my orthopedic surgeon friends about it all the time. They have their view on it. I have mine. If you want to learn more about this and how to heal your body, give me a call right now. We're live and we're local, as Dr. Jean used to say.
That's right. Live and local.
At 866-870-5752. Write it down. Get your pencil. I'll give you a second here. 866-870-5752. And my book, you will get for free. I even pay the postage. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The cover says, this is by Suzanne Summers, PRP and stem cell therapy might be just what you are looking for. This book could change your life for the better. And I think most people know who Suzanne Summers is. She's a proponent of natural medicine. She wrote the foreword of this book for me. And thank you, Suzanne. You're an amazing, amazing person. And she actually wrote a chapter about me in her book, A New Way to Age. She's written a few books, I think like 18 books or so, on natural health and healing. And in this particular one, this latest one, there's a chapter on the work that I do. It says Interview with Dr. Marc Darrow. And it's all about regenerative medicine. So what that means is we are regenerating the body instead of cutting things out. And in my book, I like to be regenerated. I don't like to be cut on. And I had some very bad success. I wouldn't even use the word success, that's backwards. Very bad outcome on my surgical shoulder when I was in medical school. And it took 4 years of misery after that surgery before I was able to heal it when I learned about regenerative medicine. And I injected my own shoulder, and I had a miracle. It was a miracle because this doesn't always happen, where I woke up the next morning and my shoulder was completely healed with no pain and full range of motion. Since then, I have done mega thousands of patients. I've been doing this over 25 years. And it's a lot of fun. It's a lot of fun to be in my office. Everybody's having a good time because it's different than typical medicine. It's people healing, and people love to heal.
Absolutely.
Nita, you healed. Your neck healed when I injected it.
Yeah, twice.
Twice?
Well, because I re-injured it 4 years later working out with my trainer.
Isn't that amazing?
Yeah, it is.
I'm glad you had a great result.
I did.
So let me go to some questions here, unless you have anything else to say.
Well, I think you covered everything. We could just give the phone number one more time.
Okay,
and the
I will do
website.
that. Yeah, that's a good idea. Number one, if you want to watch me do videos of these procedures, you can go to my website, which is www.jointrehab.com. That's www.jointrehab.com. Endless pages of information on stem cells and PRP, platelet-rich plasma, and lots of videos of me doing the procedure. See if it's something you may want to do. And if you want to call and talk to me right now, and I hope you do, it makes the show so much more interesting, because otherwise I'm going to have to torture Anita with corny jokes.
Oh, please
Call. Please call.
Please call.
The phone number is 866-870-5752. So, Anita, I'm going to hit you up with one quick joke, okay?
Okay.
Put on your thinking cap. Are you ready?
Ready.
Why do seagulls fly over the sea?
Wow.
That's a hard one. It is a hard one.
That's a hard one.
Because if they flew over the bay, they would be bagels.
Oh, now I'm hungry for breakfast, lunch,
Me too.
or dinner.
Me too. I usually intermittent fast where I don't eat till the afternoon.
Same here.
Yeah. I really don't get hungry in the morning, though, to be honest. And then when I get hungry, I feel good about being hungry. All right, I'm going to hit you with one more because you have a good laugh today. You ready?
Okay.
What did the tomato say to the other tomato during a race?
Tomatoes don't talk.
Ketchup! Nita, you're so happy and gorgeous today. I love it.
Thank you. I feel good today.
I know you do. I'm so happy. So I'm going to go to some questions now until we get some callers, if you don't mind. I do want to mention a couple things. The regenerative medicine, although I do it on the musculoskeletal system, all the joints, ligaments, and tendons to rejuvenate them, thicken up the tissue, grow back the cartilage, and get rid of all the enthesopathies around the body. That's really what a lot of people end up getting surgery for when they don't need it, which is really like a sprain. It's like an ankle sprain. When you sprain your ankle, do you run to the orthopedic surgeon to get a surgery? No. But when it's a back sprain or neck sprain, you do, because it's more of a sensationalistic area and people get nervous about it. But it's the same thing. We can heal that up typically. So be careful that you do not have a surgery that you do not need. I had one. Okay, it was hellacious. All right, this one says PRP or bone marrow for knee pain after cancer treatments. Well, this is interesting. Okay, so it reads like this. My wife is 64 and has been undergoing breast cancer treatment for years. Her red and white cell counts are low to the medicine she takes. Would your PRP or bone marrow treatments be hindered in patients like her? She has 2 bad knees, runs in her family. I know that's a general question, and I don't want to get our hopes up for the success if the rate is small. No, this is no problem really. I treat people with all kinds of cancer. I don't typically like to go into the bone marrow if there's a cancer that could be invaded the bone marrow, because we don't want to spread that around. So I check with the oncologist first to see if it's the type of cancer that could have spread to the bone. If it is, we can still do PRP or platelet-rich plasma, where we just take your blood. And having low red and white counts is not a problem for that. We do need to have a decent platelet count, but you would know if you didn't qualify, because you would be bruised all over the place from low platelets. That's different than someone that takes a blood thinner and has bruising because of that. We can treat people with that, so that's not an issue. So most people that have musculoskeletal pain, and this woman has knee pain, we can help heal up. I've healed my knees with it. I don't know, Nita, if you know. You probably know. I've injected both my knees with platelets and stem cells, and I've done my wrist. I healed my wrist, my shoulders. What else? I had some broken ribs years ago that I injected and healed that up.
We have a caller, you know.
We do. I love that. Okay, it's Jerry. Fractured lower back 3 years ago. You poor guy. What happened, Jerry?
My name's Jerry. 3 years ago, I fell on the bus and compressed fracture lower vertebrae. Is it very unusual to get a fracture vertebrae when you don't fall from a height?
Yes. What is your age? Is it Gary or Jerry?
Gary.
Gary with a G. Okay. So, Gary, I'm so sorry that happened to you.
Gary's my name.
Yeah, what is your age, if you don't mind sharing?
My age? 81.
Okay. So 3 years ago, you were,
I
what,
fell
78?
on the bus and fractured the lower vertebrae.
Okay.
Compressed fracture, they call it.
Okay.
Is it unusual to fracture a vertebrae when
No.
you don't fall from a height?
No. If you let me speak for a little bit, I'll explain that all to you. As we get older, we start losing our bone density. And so what happens, we end up getting osteopenia. That means a small amount of bone loss, or osteoporosis, which is a major amount of bone loss. And at the age of 81, if you're not taking testosterone, you pretty much have osteoporosis. You fell a little bit when you were on the bus at the age of 78, when you already probably had osteoporosis. So the spine becomes weakened, the bones become fragile, and it's very, 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 very common to get compression fractures in the spine. This is for men and women. Okay, so I have men as well as women do a bone density to find out how their bone density is, an examination. It's a very light x-ray that's done. And if they are low, we will put them on replacement hormones. So women, we give testosterone, progesterone, and estrogen, bioidentical, and men, we give typically just testosterone. Personally, I've been doing that for myself for the last 30 years. I'm 75. My bones are great. They weren't when I was younger. I lost my testosterone very early in life, and I found out about it because I was exhausted, and I was at a medical conference, and I saw a bodybuilder there who looked so amazing. He was a lot older than I was, and I said, "How do you look so good?" And he said, "Don't you feel good?" And I said, "No, I don't." He said, "Check your testosterone." And I did. It was low. Then I got a bone density, and I had close to osteoporosis, and I started testosterone. It's been growing back. So if you have pain in your back, that's something we can typically help even after a compression fracture, Gary, using platelets or stem cells. So if you want to call the office and get more information, there are people by the phones there. The number to the office is 800-300-9300. I'll repeat it for you, Gary. The phone number to the office is 800-300-9300. And for the other folks who are listening, if you want to call me and talk right now, just like Gary did, give me a call live, 866-870-5752 at the studio. Studio number is 866-870-5752. And Gary, I don't know if you use the internet or not. If you do, you can watch videos of me injecting backs, necks, shoulders, wrists, knees, you name it, at www.jointrehab.com. Anything else that bothers your body that hurts, Gary?
Well, I walk with a walker. My goal is to be able to walk without a walker.
Okay, and why do you use a walker? Is it because of pain or just stability?
Because of the fracture
Oh, okay.
of the single vertebrae. I have to walk with a walker.
Is it because you're bent forward, or is it because you have...
without the walker?
Good. Do you have any back pain?
Gary, are you there? Do you have any back pain?
He's wondering and thinking.
Yeah, I have some pain in my back.
Okay. So it would be great to have you come in and we could check out your back. And if you want us to check your labs for your hormones, we can do that too. So God bless you, Gary. You're a great man. And next we're going to go to Mark, who's been waiting here, about his Mom's back, and I'm going to give out the phone number one more time to speak to us live. Right now at the studio, the phone number is 866-870-5752. And if you want to call the office and get more information, the number there is 800-300-9300. So, Mark, how's your mom doing?
Good morning. She's doing well. She's doing pretty good. But I'm glad I tuned in and was listening today because I found out something and I picked up a term that I haven't even heard her doctors use, which was a compression fracture in her back.
Does your mom have that?
Yeah, again, and I'm assuming that it is because she said to me a couple of years ago, she was messing around on one of those hoverboard things that one of my nephews or somebody had, and she fell.
Sure.
And landed on, I think, her tailbone or somewhere on her back, and didn't think nothing of it. And as of late, sometime earlier this year, it just got progressively worse. Actually, last year, where she started hunching over and feeling pain in her back. And if I'm not mistaken, they shot an X-ray and they told her that she had arthritis throughout her entire spine. And this last time she finally went down, she fell, and the nurse was there. They called the ambulance, took her to the hospital. They ran some tests. They called in an infection disease specialist, and they were able to determine that she had an infection that had set up in her back, in her spine, on one of her vertebrae, I think it was.
Okay.
And from that, the swelling and everything, she's been bedridden ever since. She hasn't been able to get out of the bed and walk.
Oh, I'm so sorry.
They've got her in a rehab center right now where she's receiving, rehabilitation and therapy every day. But they get her up out of the bed, and now she's able to stand briefly. But she said the pain is just so.
Oh yeah, that's horrific pain. Yeah, is she still on IV antibiotics?
No, she did IV antibiotics for 6 weeks.
Okay. Well, that's good. I'm glad the infection is gone. That's a very, very, very painful thing to have. My mother had it too. Same thing. And she recovered from it, thankfully, and did well.
Yeah, so that was the purpose of the phone call, to find out if I don't know if it's going to be possible for me to get her to you.
Okay.
Or if maybe there's you can refer someone out there that I can go out there and have them go to the rehab.
I'll tell you what.
Visit with her.
Why don't you send me an email through my website at www.jointrehab.com with the information, and I'll give you a call, and we'll see what we can do about your mom. Okay?
Yeah, she's 69 years old now. It's hard. It's really taking a toll on me and the rest of the family.
Of course. Yeah.
Medicare quit paying at one point. They wanted to send her out of the rehab center because she had quit progressing.
Oh my gosh.
And we appealed it, so we're trying to get her back on her feet.
Well, she's a young woman at 69. My goodness. And she needs a tune-up. I think.
Go ahead. I'm sorry.
It's okay. She might do very well with regenerative medicine, the platelets and stem cells, to get rid of her pain in her back.
I hate to say you were a last resort because we had faith in the doctors and the antibiotics, and he thought that they could get her. My mom's been in constant pain. I'm 41 years old. She's been in constant pain for at least the last 30 years. The last 30 years that I know of. She's on,
Mark, the issue is this.
Painkillers,
Yeah. The issue is this. Traditional medicine is very good for people's lives being saved. So if you're dying and you go to the intensive care unit, they're pretty good at that. But they're not great at quality of health. That's not what we're trained at in medical school. We're trained in what's called acute care medicine.
Right.
That means when something terrible happens, that's what we're trained in. So in order for a doctor to be able to do the kind of work I do, which is natural medicine, and specifically my work now is using stem cells and platelets to heal the musculoskeletal system. But there's a lot of things. You mentioned opioids and all that. She's got to get off of that stuff if she's on it. There's just a lot of things she needs.
we're trying hard to get her off of it, and she, I know she's dependent on it.
Well, so far, but there's a way to wean her off where she won't even know the difference, and it's got to be done slowly.
Okay.
I do it all the time with patients, because that.
I truly hope this is the miracle. It's a miracle.
Well, I don't know about miracles because it's not a miracle to help people. It's just using your brain and doing things that work rather than traditional things that don't work. You got to think outside the box to help people and everything. I don't care what it is. So God bless you, Mark, and God bless your mom.
Okay, one more. Thank you. One more thing
sure.
before I go. She's developed a nerve pain in her hip now all of a sudden as well. Extreme. They've got her on nerve meds for that now. So they're just medicating her.
Yeah, I don't believe personally from what you told me that that's a nerve pain. It could be, but if it's in the hip, it probably is not. And I'd have to, this is what I tell everybody. They go, let me send you x-rays. Let me send you what the doctors wrote. Let me give you the diagnosis. I go, I don't care about any of that stuff. I don't care about the images. I've got to examine a person with my hands and find out where the pain is being generated from. These other things mean nothing to me. Most people come in with the wrong diagnosis.
Right.
If a doctor's not using his hands to find out what's going on, you've heard me talk about this
for a while, Phil.
All right, cool. Yeah,
So
you can't diagnose anybody from films. It just doesn't work. Not for musculoskeletal pain.
Yeah, can you give me that website one more time?
Absolutely.
jointrejuvenation.com?
Close. It's www.jointrehab.com.
Rehab. Okay. Thank you.
Jointrehab.com.
Thank you for your call,
Thank
Mark.
you so much for taking the call.
Mark, I got one last question for you. Do you have any pain in your body? You're 41. You're on the edge there.
Yeah, my knees. I've thought about coming and see you myself. My knees are shot. Playing basketball, jumping up and down. Sometimes I go to walk up a set of stairs, and I'm knock-kneed too. So sometimes I go to walk up the stairs.
Yep.
And I'll put the weight on that knee to run with, and it feels like I got bone on bone rubbing in my knee sometimes. The pain is so excruciating. Now my leg almost goes out.
Okay. Well, basketball players, runners, and people like that end up with what's called patellofemoral syndrome, where the back of the patella bone, and you can look this up if you want to see it on Google. Just look up Google and look up patellofemoral syndrome. And then on the upper left-hand corner, there's a spot that says images. Click on that, and you'll see what it looks like. The back of the patella has very thick cartilage, but from jumping and running a lot, it wears out. And the patella fits in a groove in the femur called the trochlear groove. And it's supposed to slide. But as we beat it up a lot and do too much, that groove wears out. And then the patella gets stuck, and then we get what's called crepitus, or grinding. And it's a very, very painful thing. And there's a few ways you can know that you might have it. One is going up and down stairs, and then if you're ever sitting in an airplane or in a theater where you're kind of cramped up and your knees ache.
Yes, sir. I know exactly because I experience that pain in long car rides. If I sit in the car in the back seat for too long, I can't sit with my knees bent too long. My knees, it's unbearable.
I hear you. Anyway, it's something that I work on every day with patients, and it's something that platelets and stem cells can help rejuvenate the cartilage there and smooth it out and get rid of the pain. All right?
Well, I probably will come be seeing you myself then shortly because
I'd love to see
older.
it. Well, go see the movie Benjamin Button, and you might start getting younger. The Brad Pitt movie.
All right. Hey, God
bless you too. And the whole point of the work I do is to rejuvenate the body, and make parts of it younger. And you can regrow tissue. Oh, we're at the break, Nita. So I'm going to give out the phone number to call me. After the break, you can give me a call live at 866-870-5752. If you do, I'll give you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate for free, and I'll pay the postage.
Yay. And we'll be right back after this.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.